As already mentioned, this is for training purposes and come directly from the Department of Education. The ultimate goal is to adequately prepare you for the safe administration of medications to our students.
There are 4 segments to the handbook. If you have any questions with regards to any of these sections, please find the nurse in your building and she will be able to answer them for you. The first section will include the law, resources, and anatomy. The second section will be identification and documentation. The third section will be the technique of administering medications, and the fourth will be troubleshooting. First, the law. I don't need to read each of these out for you, but you may want to familiarize yourself with them for future reference. Again, here are some more specific laws that govern what we do.
Anyone that will be giving medication during school time or events needs to have had the training to administer medications to our students. Unlicensed school personnel must review, understand, and follow the district's medication administration policy. There is a PowerPoint presentation on this policy if you are interested, and it is listed on this training site. The school nurse will periodically review records to ensure that medications are being given appropriately. Health information is to be kept confidential. This information will be shared with those that need to know. These are your resources. If you have any questions, don't hesitate to reach out.
So now we move on to anatomy. Some oral medications are absorbed differently. Some should be given with food and some should not. Be sure to check your prescription bottle. It is almost always listed on the bottle if it should be given on an empty stomach or with food. In review, know your medication policy or be able to access it. Know our local community resources. And know your procedure for accessing the school nurse. So let's talk now about identification and documentation. You have generic versus brand name, which would be Tylenol versus acetaminophen. Prescription versus over-the-counter. Penicillin versus Dayquil. And then there are those regulated by the federal government or simply controlled substances. These would be codeine, Ritalin, or Tylenol with codeine.
Here is a list of medication examples, what they do, and what common side effects they may have. If you would like a copy of this slide, please see your school nurse. Here are some examples of over-the-counter medications: ibuprofen and acetaminophen, and examples of emergency medications like EpiPens and glucagon.
Now we're going to talk about what is in a label. The prescription label can be quite confusing. Be sure to read it 3 times. First, when you take it off from the shelf. Second, before you give it to the student. And the third, when you're returning it to the shelf. Here's a breakdown of a prescription label. The most important part of the label is the patient name, medication, dosage, and how often it is given, and let's not forget the expiration date. Here are some of the most common abbreviations you might see. The list can be a little overwhelming. If you see an abbreviation that you're not familiar with, seek out your school nurse for clarification. Never give a medication if you don't understand the directions.
Now for documentation. Documentation is so important. Always document medication immediately after it is given, for all of the reasons listed. The nurse's office can be quite busy, and if you don't document it at the time, it can easily be forgotten. We have specific forms in all of our buildings that list the student name, medication, dose, and what time it should be given. The person administering the medication should sign the medication sheet, initial the day and time. If you gave it, you need to document it. Don't call to have someone else sign it off for you. Medication errors, including wrong dose, wrong student, or missed medications, should all be documented on a medication error form and the school nurse notified. Schedule 2 drugs. These are going to be your ADHD medications. Need to be in a double-locked cabinet. They need to be counted when a parent brings them in, documented, and have both parent and person receiving them sign the form. They also need to be counted after each dose given and signed off on the form. If a parent takes them home, they need to be counted and signed out on the form by both parent and person giving them to the parent. These are federally regulated medications.
In review of documentation and identification, document on individual student health forms. Document immediately after administration. The person administering the medication needs to document. Document the time, initial it, and sign the form. And most importantly, if it isn't documented, it was not done. Remember the 5 rights of the student. The right student, the right medication, the right dose, right time, and right route. Never touch the medication directly. Follow the pharmacy directions and stop and recheck if you feel that something is wrong. On to allergic reactions. The slides that follow may indicate an allergic reaction is occurring, but it may not. The most important thing here is to just notify the school nurse and be prepared to administer an EpiPen.
Symptoms can range from mild to severe, itching and swelling of the lips, tongue, or mouth, to hoarseness, cough, and difficulty breathing. Other mild symptoms that could easily progress to severe: a rash, hives, swelling in the extremities, nausea, cramping, diarrhea, and fainting. The never-ending question of when to call the nurse. When there is a question of whether or not to give a medication, when a new medication is received or a change in dose, when you can't read the label clearly, when the medication dose does not appear the same as usual, if a student refuses to take the medication, if the student has unusual symptoms after taking the medicine, and most definitely when a medication error has occurred. If the school nurse is not available, the parent and/or guardian or healthcare provider should be contacted with questions.
When preparing to give medications, give this task your full attention. This is a no-talk zone. Prepare meds for one student at a time. Ideally, the same person should give the medications each day. Make sure you have plenty of light and assure privacy and confidentiality to the student. Also, don't forget to wash your hands. Make sure you ask the student their name and what medication they take. Check the student's medication record. Check the photo if you have one to assure you have the right student. And explain what you are doing. Retrieve the medication from a secured storage. Check your 5 rights. The medication should be given within 30 minutes of its scheduled time. This can be done 30 minutes before or after the scheduled time. If it is not given during this time frame, it is considered a medication error and should be documented as so, and the school nurse notified.
Check the label. Check for the expiration date. If it is expired, do not give the medication and notify the school nurse. Compare the label to the medication record. When you are sure everything is correct, remove the cap and place it topside down so as not to contaminate the inside lid. Do not give the medication if it is contaminated. Do not leave the medication unattended. Store the medication appropriately in a locked storage area. Double check the student's name when returning the container to storage. Observe the student for unusual symptoms and always wash your hands. And finally, per school procedure, document immediately.
Now we'll talk about common methods of medication administration. I can't say it enough. Wash your hands first, and then follow the directions of the medication bottle before removing the lid. For example, you may need to shake well. For a pill, hold the lid or medication cup in your hand. Pour the correct dose into the lid or cup and pour into the open hand of the student. Do not pour pills into your hand. And obviously provide water if needed. For liquid medication, pour into a medicine cup from the side of the bottle opposite the label, and then wipe the bottle with a clean cloth and give the cup to the student. Observe taking the medication and make note of any unusual signs. And always wash your hands when you are done. For eye medications, first wash your hands. Put on a pair of gloves. Gently wash any debris from the eyelid. Follow the directions on the label. Loosen the dropper lid and squeeze to fill the dropper to the desired amount. Position the student lying down or sitting with the head tilted back. As pictured, gently pull the lower eyelid down to form a pocket or sac. You may want to hold a cotton ball in this hand so any liquid that escapes won't run down the student's face. Apply the medication into the pocket, holding the dropper a half an inch above the eye. Do not touch the eye with the dropper. You may want to brace your hand on the student's cheek or nose. Replace the dropper and gently wipe the eye with a cotton ball from the inner eye to the outer eye. If using ointment, place the ointment from the inner eye to the outer eye. Press the tear duct gently with a cotton ball for 30 seconds to decrease tearing and increase absorption of the medication. Have the student keep their eye closed for 2 minutes. Tell the student their vision may be cloudy for a short time.
Medications for the ears. Warm the medication in your hands for a few minutes. Follow the directions on the label. For example, you may need to shake well. Loosen the dropper lid and squeeze to fill the dropper to the desired amount. Ask the student to tip head sideways or lie down with affected air up. Pull the earlobe up and out for older children and down and back for younger children. Hold the dropper 1/2 inch from the ear, not touching the ear with the dropper. Squeeze the prescribed dose. Have the student stay in the same position for 1 to 2 minutes to assure the medication is dispersed to the ear canal. A cotton ball may be put in the ear, and when you're done, wash your hands. Now for topical medications. This could be anything from chapstick to hydrocortisone cream. You start by washing your hands, put on gloves, and administer a thin coat of medication with a gloved hand, tongue depressor, or Q-tip. Remove the gloves and wash your hands. For nose drops or sprays, start by washing your hands. Have the student tip their head back, whether they are standing or lying down. Place the dropper slightly in the nostril and administer the correct number of drops. Do not touch the nostril with the dropper. For nasal spray, insert the nozzle approximately 1/2 inch into the nose and spray as directed. Have the student remain in this position for 1 to 2 minutes to assure that the medication reaches the upper nasal passages. When you are done, wash your hands.
Medications delivered by an inhaler vary depending on the type. Carefully read the specific instructions. The following is general instructions. Be sure the canister is firmly inserted into the container. Have the student stand, shake the inhaler well, and remove the cap. Everyone that uses an inhaler will benefit from using a spacer, whether it is a child or an adult. In any event, have the student exhale completely, When using a spacer, have the student close their lips around the mouthpiece. Have them take a slow, deep breath, at the same time depressing the canister. Have the student hold their breath for 5 to 10 seconds. Replace the cap on the inhaler. If the student does not have a spacer, have them open their mouth wide. Hold the inhaler 2 fingers away from their mouth. Do not put anything into the mouth. Then follow the steps described with the spacer. If the student has 2 different inhalers, always use the bronchodilator, for example the albuterol or ProAir, first, and then use the inhaler containing the steroid, such as Flovent, after. If the student is to get a second dose, wait at least 2 minutes in between doses. Clean the spacer mouthpiece with warm water, allow air dry completely before storing, and monitor the student for changes in respirations. When done, wash your hands.
On to emergency medications. When an emergency medication is given to a student, 911 is always called. EpiPens are given for severe allergic reactions. When you see someone sitting in the tripod position, which is the position seen here, this is a sure sign that someone is in trouble. You want to follow school policy for emergencies and contact 911. Make sure you have the correct dose of EpiPen for the student, adult versus junior. The EpiPen design has evolved and is now ergonomic. Pull the blue safety cap. Hold it at a right angle to the outer thigh. Press hard and hold for 10 seconds. You will hear a click and will know it's injecting. Monitor breathing and discard in a biohazard container.
Glucagon is used for extreme low blood sugars as a result of too much insulin or an insulin reaction. When a student with diabetes is found unresponsive, this is most likely the cause. Contact 911. If possible, contact the school nurse or physician before giving glucagon. Consult with a parent if neither can be reached. Get the glucagon kit out. This should include alcohol swabs, syringe, and medication. You may also want an emesis basin, as the student may very well vomit after the injection. Remove the seal from the bottle. Wipe the rubber stopper of the bottle with the alcohol swab. Remove the cap from the syringe, not touching the needle. Plunge the needle into the bottle, pushing all the fluid from the syringe into the bottle. Without withdrawing the needle, gently shake the bottle until the powder is dissolved. Turn the bottle upside down and withdraw the medicine. Remove the syringe from the bottle. Remove all the air from the syringe and recap the syringe. Clean a 2-inch area on the upper arm with an alcohol swab. Remove the syringe cap. Gently grasp the arm around the cleaned area with the opposite hand. Insert the needle at a 90-degree angle and push all of the medication in. Count to 10 and then remove the needle. Do not recap the needle after injecting the student. Have the student lie on their side with an emesis basin and expect the student to vomit. Monitor for seizures and breathing difficulties. If fully awake, give fast-acting foods such as orange juice or regular soda.
Always remember, there is only one way to administer medications to our students, and that is to follow our school policy. As I mentioned previously, our school medication policy PowerPoint can be found on this website. Please take the time to review it. In review, practice reading prescription labels. Practice with EpiPen and glucagon trainers. You can find those in the nursing office. In review, practice reading prescription labels. Practice with EpiPen and glucagon trainers. See your school nurse for the trainers, or if you have any questions. Thank you for taking the time to review. You can complete the test, and you will be updated for the year.
Now let's let's take some time to review the medication administration quiz that you will be taking in a few moments. Giving a medication PO means A, partially open, B, by mouth, C, per orders. The correct answer is by mouth. Caitlin's medication clonidine is due at 2 p.m. At 2:40, you realize it has not been given. You should not give the medication because it's too late, complete a medication error report and call a parent, give the medication and document it, call the student down and tell her to call her parents to explain why she forgot her medication. The correct answer is complete a medication error report and call a parent. Medication administration should be documented with your initials. A, within an hour after administration. B, as soon as the medication is given. C, at the end of the day before you go home. D, just before the medication is given. The correct answer is B, as soon as the medication is given. The most important requirement for safe administration is A, a medication chart, B, observing the rights of medication administration, C, knowing the student by name, D, memorizing the side effects of each medication. The correct answer is B, observing the 5 rights of medication administration. When a student hands you a plastic baggie full of pills, you should A, take them and thank the student for bringing them in, B, ask the student what they are, C, call the parent for clarification and explain the requirements of the medication policy, D, contact the school nurse, E, answers B, C, and D. The correct answer is E. Ask the student what they are, call the parent for clarification, and explain the requirements of the medication policy, and contact the school nurse.